Okay, we're live here from Alpharetta, Georgia. I never thought I'd live in Alpharetta, Georgia, hoping to move to Miami. But for now, I'm here. I have with me two wonderful physicians. I have Dr. Chiara Insalaco, who is a plastic surgeon from Rome, Italy. She spent 2 years training with me, and now she runs her own practice in Rome. And I'm very honored to have Dr. Silva from Rio de Janeiro. She's a dermatologist. She's an author. We were going to show a picture of her book. She has her own textbook in dermatological flaps and all kinds of amazing procedures that she does. So you're visiting, you're learning hair transplant surgery. What have you learned so far?
Yeah, it's an honor for me to stay here. I'm dermatology. I do reconstructive surgery, but I'm interested in hair transplantation. And I heard about Dr. Cole is the best, and so I want to learn. And I am so happy, so glad to be here because this opportunity is very important for me. And I want to thank him very much for this. And so I am very happy.
Well, great. We're glad to have you. You've been a delight to have. You know, since you've been here, we've had a lot of different cases. And the first case, we walked in and I said, I don't know if I can do him. You know, he's going to be really tricky, really difficult.
Yes.
And he's an African American from Ethiopia. And but it worked. It worked fine.
Yeah. I saw the cases, very beautiful cases.
Yeah.
And the time and that's beautiful cases.
Yeah.
It's so important.
Well, everyone's been different. Every case has been different, and what we tried to show is that there's no one single approach to every patient. For example, today the patient had very large follicular groups, and we had to change the punch style entirely to get the grafts out. You've seen what? Rotation, oscillation.
Yes.
You've seen the zero T punch. You've seen the window punch. You've seen the regular serrated punches. You've seen me set various protocols, different RPMs, different oscillatory programs, rotation with oscillation,
Yes.
all kinds of stuff, right?
Yes, I learned so much.
Yeah. Well, we have 2 more days, so hopefully, yeah, 2 more days. Hopefully, we'll do some beard hair or maybe an eyebrow or something like that. We'll see.
Yes,
Yeah, a couple of big cases coming, right?
Okay.
Now,
Thank you very much.
well, we're just delighted to have you. Okay. And Dr. Insalaco, we're currently working on a PhD in Rome. She visits periodically, not as often as I'd like, but she gets here from time to time, and I get a chance to visit her in Rome. And we're going to show some cases here of hers, her surgical cases. She's becoming more and more popular in Italy. She doesn't get much time off anymore. So that's great for her.
Thank you.
Yeah. Now I want to talk. You know, I walked in this morning and I spoke with our engineers, Chuck and Tommy, and I said, "Hey, we're going to go live today." And you know, we've been setting up for this for a while, but we really haven't put all the pieces together yet. And I said, "We're doing it today." And so they've been running around crazy trying to get everything together. And we ran into a problem with some of our microphones. So we'll solve all these things shortly and hopefully do a better job. I was going to go through some presentations with you. We're going to solve that issue so we can show more before and afters and that sort of thing and get into some specific cases of how we do things and why we do them. But for me today, the one thing we know about hair loss is that hair is not permanent, and once it's gone, it's gone. There is nothing that is going to regenerate it. Well, maybe almost nothing. And Dr. Insalaco is going to show some amazing results. But you know, all hair cycle. They grow, they rest, they fall out, and they regrow. The hair follicle is the only structure on the human body that grows, rests, falls out, and regrows. You think of your fingernail, it just keeps growing, But hair grows for a period of time, and in the normal anagen phase when you're young, that duration is about 5 years. And then it will rest for about 3 months. And then it falls out and regrows. And it continues to do that, but it has a limited number of cycles, like a cat's lives. Now, some cats may have 9 lives. Well, a hair follicle only has so many lives. And once it reaches that critical number, it's gone. Now, in androgenic alopecia, hair doesn't grow for 5 years any longer. Let's say over time, it miniaturizes and only grows for 1 year. But it rests for not 3 months, but maybe 1 year. And at the onset of the resting phase, or telogen, there is an inflammation. This is a T cell mediated inflammation, and all through this resting phase there is inflammation, and it causes destruction of the stem cells. So the stem cells are necessary to regenerate that follicle into the next cycle. And this inflammation over time destroys these stem cells, and there's nothing left to initiate the next cycle. And that's why once these follicles reach that state, there's no way to bring them back. There's no stem cells left. So we would have to actually add stem cells in order to get these follicles back. So the whole goal with anti-aging medicine today with hair follicles is to maintain those hair follicles in the active growing phase. And by doing this, we reduce the inflammatory burden on these stem cells, and we prolong the life of the hair follicles. So the goal, we talk about women, treating their skin to maintain their youth, and glowing example of youth. You maintain your skin as we get older, we look better. And I wish I'd done that instead of all the sun I got. But we don't talk about anti-aging for your hair follicle. The hair follicle is not designed to live 70, 80, 90 years, but the human might live 90 years. In fact, it's estimated that by 2010, women will live to 96 years of age, and men will live to 93 years of age. So this is really, something that the hair follicle is not designed to do. So we have to start anti-aging medicine now. And the anti-aging medicine protocols could be injections of PRP annually or every 6 months, finasteride, and we're going to talk about topical finasteride. I'm going to show some cases of Dr. Insalaco. And you talk about Wnt upregulators. We've got a Wnt Act product that's out of Italy, that's manufactured there. It's plant-based, it's all natural, and it promotes Wnt. And we know that the onset of anagen, or the regrowth of those follicles, is induced by Wnt. So it's a Wnt pathway that induces the new follicle to grow. And topical minoxidil, dutasteride, nice oral shampoo, and probably a host of other things that we'll discover over time. So with that said, we're going to show some of your before and afters with topical finasteride. I want to showcase some of your results. Dr. Silva, you'll be showing your results with us pretty soon too, right? Yeah?
Yeah, so it's very good.
Good. So so why do you use topical finasteride? Who's a candidate for topical finasteride?
Topical finasteride is something that we can consider new. Of course, finasteride is not a new medication. It's one of the oldest, along with minoxidil medication for hair loss. But recently we started to use topical finasteride mainly in people who are not yet a good candidate for hair restoration. It means very young people. They come to the office, they ask for restoration, but a good and honest doctor should say, no, you are too young, not yet, about if you have a hair loss family history. So you should start to treat the patient with medication. And why topical finasteride? Because many patients are scared of Propecia, also oral finasteride, because the side effect that can come, they may not come, but patients are just scared. So you have to offer something that they are comfortable with, and you are sure they will follow every single day. without skipping days, without skipping weeks. So I started at least 1 year ago with using the topical finasteride, and little by little my patients started to call me back, thank me for the result. They have their hair back finally, so every one of them is happy with 0 side effect.
Yeah,
So-
that's the interesting thing is that with the topical finasteride, you're not seeing the side effects that we see with oral finasteride.
No one of my patients claimed that, and is a local treatment. So I also use a low percentage in the compound lotion I make. So I write the formula, and the pharmacy will provide for the patient.
Great. And in your prescriptions, it's a combination of finasteride and minoxidil?
Yeah, I put a little bit of minoxidil, like 2% of minoxidil. We saw in many studies that after 6 months of minoxidil medication, 5 or 2% is almost the same. So we don't have any reason to put patient on 5% of minoxidil when they can have a good result with a lower amount of minoxidil. Yeah, but I combine both finasteride and minoxidil.
Yeah, that's an interesting protocol. You know, we always felt like we got better results when we gave oral finasteride plus topical finasteride than when we just used finasteride or minoxidil alone.
Yes.
So you think the combination is really important in the topical therapy?
Yeah, I think that is important. Yes, I think they play a different role. Of course, finasteride, I think, play the main role in this.
I see.
In this, yes.
All right.
result.
So when you take let's say for example a dose of finasteride, it goes into your stomach, and then it has to be processed through the body and then get to the scalp.
Yeah, exactly.
And so the concentration throughout the body is spread all over the place, but perhaps not as good in the scalp. Do you think?
Yeah, I think is the topical finasteride go directly to our goal, that is the bulb, and at the same time we are not scared about spreading in our body, so
Right.
we stay there. Of course, we have to know well the right percentage to give the patient, so we have to remember it is important, is still a medication, so we have to know well the molecular and give the right percentage to the patient. So it's not enough to give a local finasteride, but it has to be the right percentage, the right amount, with the carrier. The carrier is the most important thing inside the ingredient.
So the carrier is what delivers the product
Exactly.
to the follicles.
It's not enough to put finasteride. It has to be with the right carrier. That
You can't just shake finasteride powder on
of
your
course,
head.
no, you can't. It doesn't make any sense.
All right. So the carrier is important. The compound, the concentration. A lot of secrets here.
Of course.
That you're familiar with non-steroidal anti-inflammatory agents like Motrin and Ketorolac and things of this nature, and you're familiar that a high percentage of patients have gastrointestinal or stomach problems, complications, or they can have cardiac complications, including myocardial infarctions, increased risk of heart failure, things of this nature through the consumption of oral non-steroidals. And
Yeah.
so you have the non-specific COX inhibitors and you have the COX-2 inhibitors. And the COX-2s affect the heart and the non-specifics tend to affect the GI. But none of them are probably totally safe for the heart. But there's a new idea, which is a topical non-steroidal and applied to the skin. And a single dose of a non-steroidal would require you to put 100 of these patches on your body to reach the same blood concentration, right? And so, it just makes sense that the topical finasteride would work much better than the oral without the side effects.
Yeah, exactly.
Yeah.
This is the main reason.
And so, this is what I'm seeing from the topical finasteride. The results are amazing. Would you agree?
Yeah, I agree.
Would you say that the results from the topical finasteride far exceed the results from oral finasteride or Propecia?
I will say that. On my experience, I will say that. Yeah.
From my experience, I say it's 1,000% better.
Yeah. The
You know,
result is outstanding.
Yeah, you know, for me, the side effects of finasteride, including sexual dysfunction, breast enlargement, brain fog, depression, and these are things that can come on, you know, 8, 10 years after you've been on the product. To me, the risks outweigh the benefits in most cases. You know, I'm a big fan of slowing down hair loss and anti-aging medicine, but I'm not a real big fan of turning a guy that's a normal, happy, healthy individual into a depressed individual with sexual dysfunction, and maybe get to the point where his wife leaves him, he loses his job, all this sort of thing. So the topical finasteride, to me, it's the first time I've really been excited about finasteride.
Yeah. And also the psychological approach of the patient is different. When patients know they are taking oral finasteride, they can have the nocebo effect called, not placebo but nocebo effect, so they feel all side effects on them, even though sometimes they are not real 100%. Since they start to take just topical finasteride, they are more comfortable, they feel more safe, so they keep going with the lotion, the medication in a constant way.
Good. Is there any way we could show some of the before and afters, Tommy, Dr. Insalaco, with the topical finasteride? Do we have that capability yet? Yay or nay?
Yeah.
All right. Well, let's put it up, and you can kind of explain it. These are patients that are what, 3, 4 months out?
Yeah, there are many patients. I'm going to show many different patients, different ages. For example, here we have, yes, 52 years old. Want also to keep the result. It's thicker, and the patient is happy, and he will keep going in this direction for at least 1 year. So every 3 months I will check on him to see any difference in his result.
All right, how about the next?
The difference is made from the machine, the device you use, the kind of activation, and also the result. This one is another patient. He's a 28 years old patient. He's a basketball player, pretty much well known in Italy, and was too I gave him just a local finasteride treatment, and after 6 months and a half he sent me he called me, he thanked me for the result, because finally he has his hair back. He's also a model, so he take a lot of pictures to advertise clothes. He told me that now he feels much better, and also his advertisement picture are amazing. And I'm going to show you the result. I want to say
Be nice to see the result.
This guy doesn't have any hair loss family history, and this one, yes. We will start to see the result. So,
you got some more results?
Yeah, we should have more result of this guy. So all this hairline is full now. Before he had the recession. Of course, we have to say that in order to have a result, this one is the post. So the hairline is completely full.
Yeah.
The patient is happy. It was him to contact me. Because
look at that crown filled right in, huh?
The crown is completely full.
It's amazing.
It's amazing. And it's so young patient is you don't want to treat the crown so early. The crown is going to be larger and larger, and giving hair restoration can be complicated. So it's always better to evaluate the case. In this case, we decided, and he is a famous basketball player, so he couldn't stop playing to have a restoration. He couldn't take days off for a restoration. So, and this one is 6 months and a half later.
All right, what else we got? That's great, 2 great results.
Yes, so far.
I don't think we got to see the befores in the front, but I've seen them. Then he had significant thinning up there. Unfortunately, we didn't get them up. They're just glitching the program.
Okay.
Let's come on. Take another one.
Yeah. Yeah, the result is amazing. Yeah. You know, sometimes when I have so young, this is another patient, patient 3. He's a 34 years old guy. He started to have hair thinning in the past 2 years. He wanted to have a restoration. But also he wanted to start to try with something different for many reasons. Everybody has a different reason in their life to make a decision rather than another decision. So he didn't have time to have a restoration in a short period of time. He wanted to collect his money. He's a young patient, so he wanted also to put money away for a restoration. So we started also with him, with the local finasteride. This one is before the treatment picture, and I'm going to show you the 3 months post pictures. And also him is happy. He contacted me every time to thank me, to share his picture with me. Also when he's in his car, he's in a restaurant, just because he's super happy and comfortable with the result.
Changed his life, right?
Yeah, yeah. So when he's in the car, he always send me picture. Okay, this one is the after. You can see the crown is completely filled. Also, I will say before, the quality of their shaft is much better, thicker. So the patient has a new appearance now. You don't think at all this patient has any hair loss problem. In the previous picture, yes.
Yeah, you know, the question is, how long is this going to work? Is it going to work?
Of course, this one
forever?
is a good question. We have to remember the patient has to stay on medication if they want to keep the result.
Yeah.
This one is another picture. You can see the crown is full. Also, their line.
Front's full too.
The front line is also full.
The quality of the hair is better.
Everything is better. So
His psychology's better.
yeah, in order to have the result, he has to keep going with the local finasteride. No way.
And this is consistent. You know, I've been in practice hair transplant surgery for 27 years, and finasteride's been out since, well, we started using ProScar back in 1993, and we just break it into 4 pieces and take a quarter pill a day. So I've been using finasteride in one form or another probably for 27 years, and I've seen maybe one result like that from oral finasteride.
Yeah, that's
Okay.
right.
And I've thousands and thousands of patients I put on it.
Now, of course, the restoration so far is the main technique give a really outstanding result. But what we can do, we can always combine both treatment.
Yeah, we
so
can
with
combine
the restoration,
Sure.
you give a great result. But because we have to remember that androgenetic alopecia is a chronic condition, we want to keep the native hair in a growing phase. So hair restoration is not going to do that. Restoration move the hair from an area to another one.
Right.
The result, if you do good, is outstanding. But you need to treat day by day your hair to keep the result over time, and also to keep your hair, the same hair for years. Also, that one is a successful result.
Well, that's true. You know, but you had 3 results there, and I think you brought a total of 5 results with you in a span of what, 6 months? Is it something like that?
Yes.
And 5 results in 6 months, and I've seen 1 result like that from oral finasteride in 27 years. I mean, hands down, the topical finasteride is the future in terms of anti-aging medicine. It's the best thing I've seen in terms of jump-starting hair.
Yeah.
You know, but there are other things, like, for example, you mentioned the PRP, and there's good quality PRP, and there's PRP that basically is junk. And good quality PRP is going to have 5 times the concentration of platelets as baseline, but it also is going to have a higher concentration of growth factors than bad PRP. So you can have a higher concentration of platelets, but the quality of the platelets may not be as good. So the concentration of growth factors isn't as good.
Yeah.
And you know, we know that there are many doctors that'll just spin a red top, draw off the top 2 cc's, take out 3 cc's of what they call to be PRP at this point, which is really maybe 2.5 times the concentration of platelets, and the concentration of growth factors from that's going to be next to nothing.
Yeah.
So we found a very good machine, and a good machine is going to produce 5 or more times the concentration of baseline platelet count, but it's also going to produce a much higher concentration of growth factors. And for example, I'll just name two manufacturers, Arthrex and Regen. And some of the studies that Dr. Insalaco did with me when she was here was looking at comparison of Regen and Arthrex in terms of the response of hair growth, and also platelet concentrations through ELISA testing in our lab here. And we found that Regen would result in a 25% decrease in hair density at 6 months, whereas Angel Arthrex would produce a 50% increase in density at 6 months. And we also looked at the growth factor profiles of the two, and hands down, Angel Arthrex was superior. And then what did we go to after that?
Yeah, and also we made many comparisons between 2 kind of devices, like you say, so Arthrex and Regen, and we saw how Arthrex is much better in terms of number of growth factors and also clinical result on the patient.
Right.
And next to that, the activation. So it's not enough to produce PRP, but you have to activate the platelet. Right. The platelet contains inside the alpha granules, where they are located the growth factors, and you want to open these alpha granules in order to release the growth factors. So there are many kind of activation all over the world. The most common is calcium gluconate, is a good activator. But now, thanks our study we done together in this clinic, we tested for the first time the activation through ultrasound, and we saw how much better is the number of growth factor release after sonicator PRP. So,
Yeah. And we can present some of that data in a future broadcast, but essentially what we did is we took sound energy, high intensity sound energy, and so intense that we have to put it in a soundproof box while we perform the sonication. And we have, because the energy level is quite high, we don't want heat transfer to destroy the platelets or denature the protein. So we maintain the samples at 4 degrees Celsius while we do the sonication. And then we sonicate for 30 seconds on, 30 seconds off, and what we found through the ELISA testing was that the 30-minute sonication protocol produced 6 to 8 times the concentration of high molecular weight growth factors as we could get with traditional activation either through bovine thrombin or recombinant thrombin or calcium gluconate. And so the question was, from a clinical perspective, what effect does this higher concentration of growth factors have? And what we found was that it speeds up the regrowth of the hair follicles. We also see that it improves the yield of head hair, body hair, we're talking about chest hair, beard hair. It improves the yield. Not only do you see more hair sooner, but you have a better yield.
yeah.
And what we found with the sonicated PRP at 3.5 months, we had 87% regrowth versus standard PRP of 73%. And I think there was some bleed over, another influence from the sonicated PRP in the regular PRP. Because in some studies we saw as low as 30% regrowth at 3.5 months, which is baseline what we would expect, both with saline and with regular PRP. But at 4.5 months, that's really where the men and the boys get separated. The sonicated PRP had 100% follicle regrowth versus 70, 77, 78% with standard PRP. So it's huge. And then when we start to look at the overall survival after 6 months on, the percentage of follicles that actually survive the transplant process is much better with sonicated PRP. Do you have anything else to add on PRP?
That's true. So I can say that many patients come to me just asking PRP, and every time I needed to educate them about the quality of PRP. So I had to explain them the kind of device I use, the kind of activation, how the result change based on different PRP. So PRP doesn't mean anything unless you explain the details, the kind of PRP you use. Yeah.
Yeah. All right. So just kind of going from there.
We're going to take questions for 5 minutes.
Okay. So people are calling in.
People are in the chat rooms.
They are. Okay. Real quick, I just want you to talk about Malaga. Okay. Tell me about we have a conference coming up. It's in Malaga, Spain. I believe the 26th of April, is it?
Yes,
Something
at
like
the
that?
end of April. Yes.
Yeah, and it's the 5th meeting of FUE Europe, something like that, 5th or 6th meeting.
Yeah.
Okay. And you're the program chair, right?
Yeah, exactly.
With Teresa Meyer, we have co-female program chairs.
Yeah,
right?
I'm glad. I'm honored to be the co-chair of this beautiful meeting.
And at this meeting, we're going to present our patients from last year, where we did the first adipocyte stem cell injections into the scalp, where we harvested adipocytes from the scalp.
Yeah.
So it's first time fat has been taken out of the scalp and re-injected into the area of hair loss. We're going to present that data. We also did adipocytes from the abdomen, and we did follicle stem cells, and we did PRP.
Yeah.
And we did sort of a quadrant evaluation.
Where we compare
Yeah,
the
yeah.
different results based on different treatment.
Yeah,
yes.
and I was in Ankara where we did the studies. I was there the second week of February while she was slaving away in Rome, working from 8 a.m. to midnight. And I was evaluating the patients. And I'm going to present the results there. And we're also, you got a great meeting. I think you did a good job putting that together with Chris Basanga.
Yeah.
Yeah?
Yes, is the president of FUE Europe.
Right.
Is a great society because you find the real FUE surgeon, the best in the world.
Right.
So they perform personally hair restoration. Of course, they don't let technician to do that. So they personally take care to the patient from zero up to the end of the procedure.
Yeah.
So from the beginning up to the end, and they are real FUE people who started a long time ago. FUE take a long time to be learned because as a learning curve, a very slow learning curve. So this is the reason, unfortunately, because many strip doctors takes time to take it, and they prefer not to do that or to let somebody else to do hair restoration with a FUE.
Yeah, so these are the real pioneers in FUE.
Yeah, in this society, I'm glad to say that you will find these kind of doctors.
Yeah,
Yes,
as compared to a lot of the societies that caught on to FUE in 2013 or 2012, and they really don't have pioneers in FUE that are attending their meetings. So FUE Europe is where the best of the best are coming together and collectively sharing their thought processes. As Pablo Picasso said, you have to learn like a pro before you can learn the rules like a pro before you can break them like an artist.
Yeah, that's true.
And so you literally, you have to get to the point where you know everything before you can think outside the box and change FUE. And this is the only meeting in the world where this quality of individual is going to come together in Malaga, Spain, and share their ideas and hopefully propel the whole world of FUE forward. Okay, so it's going to be a great meeting. All right, so we got some phone calls, so we'll take a few and see what happens. I think there's a time delay here, right?
Yeah, it's a slight time delay.
We like talking.
But the first question is, does Dr. Cole prescribe topical finasteride to people who can't visit his clinic?
If we can document that you have androgenic alopecia, either through photographs or an evaluation by your physician, we'd certainly be happy to do that. I would love to get the products that are manufactured in Italy because I know they work. Now there's a pharmacy in Arkansas that makes a topical foam with minoxidil. It's finasteride with minoxidil foam, and I just haven't seen the results yet. And I've got probably 1,000 patients on it already. And I did visit Milan, and we were talking with them about formulating something in the U.S. For U.S. patients and actually hopefully helping to spread it throughout the world. But thus far we haven't been able to pull this together. But right now Arkansas is my source. I would love to give it to you from Italy, but I'm not sure what the legalities are, whether or not they can ship to the United States. I doubt they can.
Is the Regenix a closed system like the Angel system?
Is Regenix or a regeneration?
When it says Regenix.
All right, look, the reagents.
Well,
Well, Angel Arthrex uses light to separate the cells. Okay, so you take whole blood, which is red cells, white cells, platelets, serum, the whole 9 yards, and you spin it and you separate it and you take out the platelet-rich plasma and separate it from the platelet-poor plasma, and then you have another chamber where the red cells go, hopefully with most of the white cells. One of the issues with Angel Arthrex is that it's, and I use Angel Arthrex. That's my system. I think that Insight is going to have a better system. They still haven't been able to deliver one to me and get me the training on it that I need. But I like the fact that it has a high monocyte concentration, which is very beneficial to follicles and also tissue regeneration. But the knock on Angel Arthrex is that it captures less than 60% of the platelets. So you have to draw 120 cc's to get 3 cc's of platelet-rich plasma. Now, out of that, you'll dilute it to about 10 cc's, which will allow you to treat the scalp. And it's far better. It's the best system I know currently, and I'm hopeful that Insight can be even better. Go ahead.
The next question is, will topical finasteride help with hair shedding? And also, does it help the front of the scalp?
And what do you say?
Of course. Is the main indication is hair shedding and of course also the front area of the scalp. Yeah, of course what you have to have is hair. If you don't have hair, you have a completely bald area. Of course the only solution, if you are a good candidate, is a hair restoration. But since you have still hair, is a good help for sure. Yeah.
Yeah, it definitely it really improves the quality of the hair. Now you got to think about what PRP does and what finasteride and minoxidil do. They promote anagen, right? So what's happening is the hairs that are in the resting phase and they're getting hammered with all this T cell inflammation and they're wiping out stem cells. What's happening is they get pushed back into anagen, and that's when the inflammatory cells go away. And there's some studies that show that if we take like lipo, which is not toxic to macrophages, and we use CL lipo, which is toxic to macrophages, and macrophages being part of the inflammatory response, if we use just lipo, which is not toxic, the inflammation persists and there's no increase in Wnt activity and no follicle regrowth or regeneration. But with CL lipo, it wipes out the macrophages because it's toxic to them. The inflammation goes away, and within days we see Wnt activity pick up, and we can see this on fluorescent staining. So what all these products do is push these hairs back into anagen, but you have to have hair to see it.
Yeah,
exactly. And that's the increased density. It's not follicle regeneration; it's follicle inducement. And again, this is a critical issue in anti-aging medicine, and I call it inflammaging. You know, you get old because of inflammation, and so we want to get these hairs back growing, eliminate the inflammation. And that's what all these products do.
Yeah, in fact, it's very important to start in a early age hair loss instead to wait till you lose all your hair, and at that point it can be very late.
All right.
Yeah.
Anything else?
Then next question is, how soon are you able to see results usually from topical finasteride?
How long after? It depends on patient. It depends, yes, on patient. But one of my patients started just after 2 months. Most of them they started to have a result after 3 months, and other after 6 months. So the result change based on patient from another patient. But I would like to say after 3 months is the time you will expect something. Of course, it will be better over time.
Yeah.
Yeah.
Great.
All right, last question we have for the night is, does Dr. Cole currently recommend CRP or the new stem cell treatment as a preferred standalone treatment option, non-transplant?
Whoa.
Good question.
It's a good question. You know, there are a lot of studies that support PRP in general. Good quality PRP is increasing hair density, increasing vascularity to the follicles or neogenesis of vessels, blood vessels, and also thickening of the skin. There's only one study that's been done on follicle stem cells thus far, and it did suggest an increase in density, but I'd like to see a lot more data on the follicle stem cell. You know, we're still working with follicle stem cells, but as standalone, I would say the PRP, the CRP is super juice compared to PRP. You know, you're talking about 6 to 8 times the concentration of growth factors, specifically high molecular weight growth factors, because it's the fiber mesh of when the platelets clot come together through coagulation. They trap the big growth factors, the high molecular weight growth factors. You know, those that are 25 kilodaltons and 35, 38 kilodaltons are trapped inside this mesh. They can't get out. And so we see a similar concentration to the low molecular weight proteins, but high molecular weight proteins like VEGF, or vascular endothelial growth factor, PDGF, or platelet-derived growth factor, all important growth factors. That's where we really see huge differences between CRP and PRP.
So,
yeah. Now, you touched on one thing. We might have some phone callers or something like that, and we're not going to stay too long because I know everybody's got stuff to do. But you did touch on one thing that FUE Europe promotes surgery by doctors, not nurses, and a lot of doctors are using nurses to perform surgery. And so if you're out there and you're wondering, well, how do I find a doctor that I can trust? And I just want to put a plug in for the IAHRS, the International Alliance of Hair Restoration Surgeons, and Spencer Coburn. He recommends a lot of physicians, and all of these physicians know what they're doing. They've been doing hair transplant surgery for years. They produce results. Okay, yeah. And I think in anything, you know, on any football team, there are going to be great players and there are going to be good players and some that are riding the bench. But the main thing is to have somebody that knows what they're doing. And the thing that scares me the most about doctors, like some plastic surgeons who think hair transplant surgery is a Mickey Mouse surgery. You think this is a really simple surgery? Like you can go home and do it tomorrow? Like you're going to be ready to go? Yeah?
You think it's simple to do FUE?
No, not simple.
Yeah, exactly.
Not simple.
No, it takes time. And what we say, start slow, start a little.
Yes.
Well, there are a lot of doctors out there that are employing nurses to do the entire surgery.
Oh,
And the
no.
doctors think the surgery is simple.
No, it's not
And it's not.
simple.
It's not. It's more difficult than doing a facelift. To be quite frank with you, it's more difficult. It takes more time. It takes more expertise. And so if you go to a doctor who's a plastic surgeon or whatever, and he doesn't know anything about hair transplant surgery. He doesn't know how to do it right and how to do it wrong. He's just completely trusting that assistant. And so, you know, if you're looking for a doctor, go to the IHRS and hopefully you'll find a great one.
Yeah.
You know, Dr. Insalaco, would you say that the best way to become a really good hair transplant physician is to learn how to do every step of the procedure?
Yeah, absolutely. Absolutely. You had to start doing everything. It means also what the nurse used to do. Cutting graft, trimming graft, doing place graft, everything that belongs also to the nurse duty. You should start from zero, and as soon as you get it, you are able to teach, to train well your staff, your nurses, and if sometimes they get sick, you can do surgery.
Yeah, you're
by
not
yourself.
you can do it by yourself.
Yeah,
Right?
yeah. You don't need to send patient at home because you can do everything. Of course, it will take longer because you saw is a teamwork, and a good team make faster the procedure.
Dr. Cole has a good team.
Yeah,
Thank
he has the
you.
best
Thank
team.
you.
Yeah, they remind me all the time. And
Yes.
they're fantastic. They've been with me. These two girls been with me. Two of them have been with me, since '03. We
And it's
lost a
not
couple
easy.
recently due to illness and marriage, whatnot. But they're invaluable. But the only way you can really know if your staff is doing a great job is to be able to cut grafts under a microscope, dissect grafts out of the donor area with loops, and place grafts and make the recipient sites. And if you don't know how to do all that, you never know if your staff's doing a great job or a terrible job.
It's
They
a
really-
complex surgery.
Yeah, I
It's
mean,
a complex
yeah.
surgery.
It's very complex. You need to check every step because
Yeah.
hair restoration is made from many steps. It's not just a restoration. It's made from many steps, and you have to check that everyone is perform 100% well. So,
Okay, Tommy, what do we want to
It's
do?
the best.
We got one last question from William.
Okay.
He's been on ProScar for many years. He wants to know, can you add the topical finasteride, I'm assuming, and what is the effect, if any?
From my personal, we'll get Dr. Insalaco's opinion, but what I would do is, first of all, Proscar is 5 milligrams of finasteride, and it's really not been shown that 5 milligrams is superior to 1. What I would do is I would wean off the Proscar and go to the topical finasteride. And of course, this is if you have hair, William. If you don't have hair, none of this stuff is going to do anything for you. You're not going to grow hair on a bald scalp. You're going to have to do a transplant in order to grow hair and bald skin. And we don't have the technology to regenerate hair today. We don't have the technology to make dormant follicles regrow. That theoretically is the cure to hair loss. Is not cloning, but rather to take those dormant follicles that have lost those stem cells and repopulate those stem cells and somehow induce those follicles to regenerate. So for now, I would wean off the Proscar and go to the topical finasteride and not try to combine them because it's just so much better. It's hands down, it's better than oral finasteride.
Yeah.
Okay. So, in your opinion on Proscar, and then we'll wrap it up for the night.
Basically, if we're talking about oral finasteride, I always prefer the regular propulsion, okay, in general. Between oral and the local, of course, I suggest local for many reasons. And if we start with the local finasteride, you can put away the Proscar, of course, here.
Okay.
I will not combine both, to be honest, because we never know the real amount. If it is too much, we need the right amount, not too much.
Okay, fantastic. All right, then, anything last words?
Thank you, congratulations.
Well, thank you. Okay, so hopefully we'll see a lot of doctors in Malaga, where you're going to learn a lot about FUE, and we'll do some more. I mean, I want to thank Tommy and Chuck for putting it together on short notice. We've been wanting to do this for a long time. I just finally walked in and said, we're doing it today, and they pulled it together. But there's some growing pains. We'd like to show you more before and afters and more slides and things of this nature, which we'll get to down the road. It may just be me in the future, but I can carry the show. But hopefully we'll have periodically some patients on. They can tell their story and what happened to them. People that have been disfigured and things of this nature, and how they wish they'd never done anything. And now they're stuck trying to do something because they chose the wrong doctor to begin with. But thanks for tuning in, and see you all.
Bye. Thank you so
Bye.
much.
And thank you,
Bye.
Thank you so
Dr.
much.
Silva, Dr.
Thank you
Insalaco. Thank you
so
very much.
much.
Thank you. Bye.
Good night.